Hi guys, my name is Amir Kubich. For today's presentation, we'll be going over cardiac transplants and kind of going over as well cardiac rehab too. We'll be going over the history of cardiac transplants, the likelihood and reason behind getting a cardiac transplant, the possible complications that can occur after that surgery is done, the importance of cardiac rehab, what it does for you, and what are the benefits of getting that. And we'll be going over the indications to be selected for a cardiac transplant, kind of criteria to hit to receive that donor heart. We'll be, after that, going into some pre-rehabilitation, post-rehabilitation, kind of the benefits of both and why they're both recommended since they're different situations. We'll also be going over into the effects of the transplant on the exercise response, as well as the medication that people typically take after cardiac transplants and the response from those medications on that exercise response as well. After that, we'll be going into different exercises, kind of why one's better than the other, and yeah. Once we finish that, we'll be finishing off with exercise testing, what testing can be done and what should be done. And we'll be going over a case study that was made, the exercise prescription for that specific case study, and the contradictions to why exercise shouldn't be done. If this would move to the next slide. There we go. Okay, so the history of cardiac transplantation. So the first successful heart surgery was done over 100 years ago, being done in 1896 as a myocardial laceration was sutured to completion. The first successful heart transplantation was done back in 1967 by Christian Barnard. The development of cardiac transplantation has continued and continues to make advancements. Due to those advancements, cardiac transplantation is a standard method to treat end-stage heart failure, which is awesome. Now, almost about 4,000 to 5,000 people get heart transplants, and that happens every year. So with that first heart transplantation, first person survived, I believe, about 18 days. That slowly progressed to a few months. For the next person, and then to half a year, and then further and further to our standard currently today. And another plus is that percentage continues to rise on the success rate. So with the likelihood and reason for cardiac transplants will typically take place to place that damaged or failing heart. They will also, hearts typically fail most commonly due to cardiomyopathies, coronary heart disease, and congenital heart disease. And when heart attacks do occur, sometimes they do leave some damage, which will be irreversible to that main pumping chamber. More than 5,000 cardiac transplants happen a year, as we did see in that first slide. And more than 50,000 people are candidates for cardiac transplantation. Sadly, there aren't more cardiac transplants happening due to an organ shortage and a lack of organ donors. Currently, 85 to 90% of cardiac transplant patients are living 1 year after surgery, which is awesome. After that, there is an annual death rate, sadly, of 4% from that, and the 3-year survival rate is currently around 75%. Back in 2016, there was a report that those who survived the first year had a conditional half-life of 13.2 years. So, some possible complications or issues that may happen after a transplant has happened. With cardiac transplantation, there is a possibility of transplant rejection, where your immune system kind of attacks itself and attacks those tissues and cells within yourself. And the researchers in 1970 did find a fungus. I'm going to probably botch this. It's called Taliploidium inflatum, which, okay, that wasn't too bad, which helped to create an immunosuppressant, which is reducing and suppressing those rejections and allowing patients to live through them, which is, got to be pretty happy about that. And then, like I said, there is that sudden acute rejection that is possible. some infections other than cytomegalovirus. There is a chance to have artery disease and transplanted heart vessels. And lastly, lymphoma and other malignancies are a possibility. Okay, so indications to be selected for a cardiac transplant or criteria. They have to have a history of repeated hospitalizations for heart failure, and they will reach that standard. They could also be in need of a ventricular assist device or artificial heart to support circulation, which allows them to hit that standard they need. Increases in types, doses, and complexities of medication is another, for like medications for heart complications is another standard. And lastly, if they have a VO2 of less than 14 milliliters per kilogram per minute, then they have hit that criteria. Some reasons people may not receive a heart transplant include organs in the body being too damaged due to that heart failure, in which case there'd be no point since there are other areas heavily damaged and low survival rate. If the pressure in the lung circulation has risen to too high of a point, then heart transplant will be unsafe. And if the patient is too frail, there'd be no point in getting that heart transplant because they will be further debilitated, and that just creates a very low survival rate. If a patient is overweight, there's no really good long-term outcomes, so they are also taken off of that cardiac transplant surgery list. And if the patient is in too good of a health, which obviously if they're in too good of a health, they probably won't be suited for a transplant since there are others in line. So the importance of cardiac rehab, I'll kind of go over the benefits of it. It does improve your peak VO2, improves your autonomic function, your quality of life, so you're able to do a little bit more with that cardiac rehab in. Improves your skeletal muscle strength, which does take a hit from that surgery as well as the medication taken for that surgery. It improves your bone mineral density, which is also reduced due to that surgery as well and the medication. And it lowers the rate of major adverse cardiac events and reverts peripheral alterations. Within that, there is heart denervation that occurs after surgery, which can be slightly reversed due to cardiac rehab. So there's pre-rehabilitation and post-rehabilitation, kind of some benefits for both. Precautions do need to be taken though, and the patient should be supervised and individualized prescriptions should be given as according to everyone's situation. And this can be done while they're awaiting a donor heart. So you do have to be mindful though of their specific situation though. And then the purpose of pre-rehabilitation is to kind of get them familiar with the exercise training procedures, build some nice habits, provide some medical surveillance to see how they respond to the exercise currently, and improve that exercise capacity, which will be reduced after that surgery. Post-rehabilitation can begin pretty soon, sooner than you think after transplantation. It's usually going to be done 24 hours after surgery, just to get them up and moving. It's going to be typically passive range of motion. You're usually going to see just walking, cycling, indoor cycling, assisted stands, and like stair steppers being done just to get them moving. Nothing too complicated, nothing too upper body related. And then exercises are also prescribed as tolerated. We're not going to really be using a heart rate reserve range since the heart rate won't be as accurate due to surgery being done on the heart and there being delayed responses. Yeah, so we're more so going to use a perceived rated exertion scale from that 6 to 20 scale. So the effects of cardiac transplantation on the exercise response. There will be an increased heart rate. As I said, there is a delayed heart rate response due to denervation that occurs due to that heart rate surgery or heart transplant surgery. And there is an increased blood pressure caused by diastolic dysfunction, reduced cardiac output, decreased maximal oxygen uptake, and there is a decreased skeletal muscle contractile force due to that muscle atrophy that occurs. Okay, so the types of medication and their side effects on the exercise response. The more common medications you're going to see is immunosuppressants, antibiotics, and painkillers. There are also other medications used depending on the person's situation, sometimes some that lower hypertension and cholesterol, and there are a list of other ones. Immunosuppressants are drugs that kind of stop your immune system from attacking itself, the cells and tissues in your body by accident, and they do suppress and prevent transplant rejection. The more common ones, and some that are used, are cyclosporin and tacrolimus. I'm not going to say the other one because that's definitely going to be botched. Immunosuppressant side effects we're going to see are muscle atrophy, which I was discussing earlier, and bone demineralization. And antibiotics will be used to reduce that risk of infection after surgery. More commonly used ones will not be said because they will definitely be botched as well. The antibiotic side effects you're going to see are decreased performance due to that fatigue that you'll be feeling. And painkillers are used, as you can assume. You'll be in a great deal of pain after surgery, and they help reduce that pain. Usually it's depending on the situation and the patient. If their pain tolerance is a little higher, they're going to be using a little less. And those painkillers can affect the pain levels and perception. So, different exercises. HIIT and MICT. HIIT being high intensity interval training, MICT being moderate intensity continuous training. The HIIT does show more of an improvement in exercise capacity, as you can see on this log on the bottom of the screen. And HIIT is going to be typically, the interval duration is going to be up to 4 minutes, with the active recovery in between working sets being up to 3 minutes. This is going to be a little bit harder of an exercise than MICT. MICT will be a little more aerobic. Heart rate peak will be between 60 to 75%, and that perceived effort will be around 12 to 15, so a little on the lighter side. HIIT can be done the first 2 to 3 weeks of cardiac rehab, and MICT is going to be performed typically starting 6 to 8 weeks after surgery, if there are no complications. If there's complications, that obviously makes it complicated, no pun intended. And going into exercise testing, so there is a limited amount we can do due to that heart surgery. We're typically going to stay away from that upper body extremity. As you can see, there's none listed because we don't want to reopen that wound from the surgery. But for aerobic testing, we will be doing 6-minute walk tests, and for muscle endurance for lower, we'll be doing sit to stand, kind of get them up and moving, see how they're tolerating everything. And for flexibility, since it causes no harm to the individual and is pretty convenient, we'll be doing a goniometer, since that is pretty tolerable. For a specific case study, Marissa Dougherty, age 53, 5'6", 143 pounds. She is a high school teacher. She just had a successful heart transplantation, no complication. Yes, we love to see it. And she can begin her cardiac rehab now. It's been 24 hours plus. Clearance was required and has been approved, and we did get her consent. Medications she's currently on include cyclosporin and nystatin, which are the immunosuppressant and antibiotics respectively. She does take some painkillers, acetaminophen, as needed. Played sports. Goal is to regain prior strength and exercise capacity. Short term, walk smoothly for 30 minutes plus. Then for exercise progression, we do have her working out 3 times per day, 5 days a week. For aerobic, about 5 minutes. And we're going to do that RPE of 11 to 13, so fairly light. We'll have her gradually increase her time as tolerated. It's going to be walking, treadmill, indoor cycling, something a little lighter. And then for resistance, 2 days a week, 1 upper, 1 lower. Upper body's going to be a little lighter. Only going to let her do at most 10-pound weight dumbbells. And then as you guys can see, some of these exercises we have listed, it's going to be like 1 to 3 sets as tolerated. Okay, I'll give you guys a little second. Then, so contradictions, all these listed here, if you do happen to see them occur, they will have a kind of stop us from exercising further, since it is a danger to the individual. If it's too high of a risk, we don't really want to be doing it. And yeah. And then here are the references. And yeah, thank you guys for joining me today, and hope you guys have a lovely day.